Potassium is an important mineral that helps the heart, muscles, and nerves work properly. In healthy people, the kidneys remove extra potassium through urine and keep the blood level normal. However, in patients with kidney failure, the kidneys cannot remove enough potassium. As a result, potassium builds up in the blood. This condition is called hyperkalemia. High potassium is a medical emergency because it can cause dangerous heart rhythm problems and may even lead to cardiac arrest if it is not treated quickly. One of the most effective ways to reduce potassium is hemodialysis. During dialysis, the patient's blood flows through a dialyzer, also called an artificial kidney. Inside the dialyzer, waste products and excess potassium move from the blood into the dialysis fluid through a special membrane. This process lowers the potassium levels safely and gradually. Most patients experience a significant reduction in potassium after a complete dialysis session. The dialysis machine uses a dialysate solution that contains a controlled amount of potassium. Because the potassium level in the dialysate is lower than the potassium level in the patient's blood, potassium naturally moves from the blood into the dialysate. The nephrologist selects the correct dialysate potassium concentration based on the patient's condition, laboratory results, and heart health. It is important not to use a very low potassium bath unless prescribed because removing potassium too quickly can also be dangerous. Dialysis patients should never skip their scheduled treatments. Missing even one dialysis session allows potassium to build up rapidly. Patients who miss dialysis are at much higher risk of developing severe hyperkalemia, muscle weakness, irregular heartbeat, and life-threatening complications. Regular attendance is one of the most effective ways to keep potassium under control. Diet also plays a major role in controlling potassium. Patients should follow the diet recommended by their kidney doctor or renal dietitian. Foods that are high in potassium should be limited. These include bananas, oranges, mangoes, avocados, potatoes, tomatoes, spinach, dried fruits, coconut water, chocolate, nuts, and many packaged fruit juices. Patients should not completely avoid fruits and vegetables, but they should choose lower potassium options according to medical advice. Many vegetables contain potassium, but their potassium content can be reduced by a process called leaching. Vegetables are peeled, cut into small pieces, soaked in water for several hours, and then boiled in fresh water. This helps remove some potassium before eating. However, patients should still follow the advice of their renal dietitian, because not all foods become low in potassium after cooking. Patients should also be careful with salt substitutes. Many salt substitutes contain potassium chloride instead of sodium chloride. Although they may seem healthier, they can raise potassium levels quickly. Some medications can increase potassium levels. Examples include certain blood pressure medicines, potassium supplements, and some pain medications. Patients should never stop or start any medication without consulting their doctor. Healthcare providers regularly review medications to reduce the risk of hyperkalemia. Doctors monitor potassium by performing regular blood tests before dialysis. These laboratory results help the dialysis team adjust the treatment if needed. If potassium remains high despite regular dialysis, the doctor may investigate other causes such as diet, mistreatments, medications, or underlying medical conditions. Patients with high potassium may experience symptoms such as muscle weakness, tiredness, numbness, tingling, nausea, or palpitations. However, many patients have no symptoms even when potassium is dangerously high. This is why routine blood tests are extremely important. Never rely only on symptoms to judge potassium levels. In severe cases of hyperkalemia, emergency treatment is required. Doctors may give intravenous calcium to protect the heart, insulin with glucose to move potassium into the cells, nebulized salbutamol, sodium bicarbonate in selected cases, and potassium-binding medications when appropriate. Emergency dialysis is often the fastest and most effective treatment for patients with kidney failure and dangerously high potassium. Patients can help control potassium by attending every dialysis session, following dietary recommendations, limiting high potassium foods, avoiding salt substitutes, taking medications exactly as prescribed, and reporting any unusual symptoms immediately. Education and teamwork between patients, nurses, dietitians, technicians, and nephrologists are essential for safe potassium management. Dialysis nurses play an important role in monitoring patients during treatment. They check vital signs, review laboratory results, observe for symptoms, ensure the prescribed dialysis settings are followed, and educate patients about diet and medication. Continuous patient education helps reduce complications and improves long-term health outcomes. Family members also play an important role. They can help prepare kidney-friendly meals, remind patients about dialysis appointments, encourage medication adherence, and support healthy lifestyle habits. Strong family support often leads to better treatment compliance and improved quality of life. In conclusion, controlling potassium is one of the most important goals in dialysis care. High potassium can be life-threatening, but with regular dialysis, proper diet, medication management, routine blood testing, and close communication with the healthcare team, most patients can maintain safe potassium levels and live healthier lives. Understanding how dialysis removes potassium empowers patients to take an active role in their treatment and prevent serious complications.